Hi, I'm Dr. Roy Jensen, and I am the Vice Chancellor and Director of the University of Kansas Cancer Center. So we're very excited about our new facility that's coming up out of the ground as we speak. It's going to be 423,000 square feet. About 2/3 of that will be research, and the other remaining third will be our outpatient clinical space that is specifically designed around hematologic malignancies and CAR-T and other types of cellular therapy. I think that there are a whole host of challenges around CAR-T. Some of the studies that we have done would suggest that patients that are eligible for this treatment are only receiving it about 25 to 35% of the time. So there are clear structural barriers to patients getting optimal therapy. And we think that distributed manufacturing at point of care facilities and also CAR-T capabilities that utilize young, healthy donors that can be altered to limit graft versus host disease and have them on the shelf ready to go is another technique that we're looking at. But we feel really lucky to have designed this facility at a point where we really think cellular therapeutics and CAR-T in particular is going to be a revolution in cancer care. That's certainly true for hematologic disease, and soon it will be true for solid tumors as well, I believe. Well, it certainly takes a lot of expertise. We've engaged consultants in this regard, and we're also hiring people on as in-house regulatory officials. And I think that's a key part of the process. With any new therapy, particularly one as complex as CAR-T, I think it's good to err on the side of caution. And as we demonstrate our capabilities, I'm sure that the FDA will, allow a little more freedom of movement. And but that comes at a cost of being able to demonstrate you know what you're doing, and it achieves great outcomes for our patients. I think the exciting thing about this field is that, we're clearly in the first phase of this whole effort. And there's many exciting new approaches being described at this meeting. And I think as over time, as those are incorporated into CAR-T constructs, it's going to become a more robust therapy that's more efficacious. And it couldn't be coming fast enough for our patients.